Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post focusing on the time burden of multiple myeloma. What do I mean by time burden? Well, specifically, your oncologist will talk to you about, certainly, myeloma. Those three fateful words: you have cancer. And you'll probably talk about chemo. You'll probably talk about therapy plans, perhaps even autologous stem cell transplant or CAR T-cell therapy. Perhaps you'll go online in myeloma online groups, and generally speaking, they'll talk about side effects, fatigue, nausea. Help me. What do you guys do? All of that's great, but rarely is it discussed about how much time a myeloma diagnosis can take, or I should say treating your myeloma in the coming 1 to 5 years. What does it do to your day, your week, your schedule? And obviously I know most about my own situation, so that may or may not be the same as yours, but to approximate. So essentially, to begin induction therapy, in my case, 6 months, 3-drug regimen, 3 weeks on, 1 week off, going to the hospital, my chemotherapy regimens, and I think this is fairly common. Some are intravenous. Yes, you'll sit at the hospital in that room with intravenous hookup. Those oncology nurses are wonderful in general. You might even strike up a conversation, get to know some of the fellow myeloma patients in that room with you. But in my case also, some of my chemos were in pill form, oral form, so you take those, and there's a specific schedule. So that's 6 months, and there are a set of issues that go along with that, whether you work, whether you don't. Everyone's was a little different. The side effects that happened during that 6 months of induction. Okay. Then I want to say I took 2 or 3 weeks off, spent a month approximately in a hospital for my autologous stem cell transplant. Now, these days, I don't know what the percentage is, but let's say for argument's sake, half are inpatient in hospital, half are outpatient, or they stay nearby. Different time factor. So, in my case, for about a month, a little less, in a hospital. I get out. Being beyond therapy, being out of active therapy is a great feeling, though it's a good chance you'll still be dealing, in this case, with low dose maintenance. Some people are affected more than others with low dose maintenance. Some people will undergo maintenance 1, 2, 3 years. It really varies in how much maintenance you undergo. My point is, I've just outlined about 2 or 3 years in and out of active therapy. I would argue that working full time would be difficult. Certainly my caregiver, in this case my wife, was extremely beneficial, helpful to me. There are some days when you just don't feel like doing much of anything, you sleep a lot. Some days when you feel reasonably okay. So that 1, 2, 3, 4, 5 years, it varies a great deal. I've left out a complete discussion of side effects. In my case, my side effects didn't really take hold until after. They're more long-term and late stage. But it's possible during induction or an autologous stem cell transplant that you'll develop some serious side effects, heart effects, heart damage, peripheral neuropathy, those kinds of things. That can eat more into your time. In any case, there's a lot that goes on. I'm only trying to paint a picture of a different side of a myeloma diagnosis, something that might not have occurred to you. So there's therapy plan, side effects, and time burden. If you have any questions or comments, feel free to scroll down, click through. I'll be happy to answer your questions. In the meantime, thank you for your time and attention.